Let's see. So you should be seeing my screen that says relieving arthritis pain without medications, injections, or surgeries. That's what you're in for tonight. As I was saying a little bit ago, it's a little bit harder to interact compared to if we were here in person, but there is that chat icon. Feel free to click that at any point if you have any questions or comments. I will ask you to respond, I think, at some point tonight here. I also will give you my contact information, even though you can chat on here, and I'll get to that at some point. I'll give you my direct contact information so that you can contact me directly on my cell phone, via text, or however way you want to. If there are questions that do not get answered here tonight, let me give you just a little brief introduction about myself. I've been a physical therapist now for coming up on 28 years. Can't believe I'm saying that, but that is the truth. Graduate of the University of Iowa's physical therapy education program way back in the 20th century, and went on to get my doctorate in physical therapy a little over 10 years ago. The company I'm with now, Kinetic Edge Physical Therapy, has been around for 25 years, and I've been around for 23 of those years. At this point, we have 8 and are soon to be opening our 9th clinic location, all in central and south central Iowa, where we deal with the individuals that have all kinds of musculoskeletal issues. Back pain, neck pain, hip pain, shoulder pain, you name it, all kinds of joint-related issues. And most of those people who come to us with those issues, unless they're young, high school athletic population or college athletes, most people do have some degree of arthritis. If you're 35 years of age or older and have some joint discomfort, you likely have some arthritis. So we're going to talk about that topic, and you're going to learn today things that I've learned over those 28 years and things that I've learned from all of my team members too. We have about 55 rehab experts in our team now and consistently growing. Our approach is very three-dimensional. I think that's really important. We're going to talk about that a little bit tonight. There's time to do stuff on a table, on a treatment table, and we do from time to time, but life happens between gravity and the ground. And our bodies have to be able to work together. All of those joints, all the links in our movement system need to be able to collaborate and cooperate together between gravity and the ground to function well over time. And that's a strong approach and an important approach. Now, you might be wondering, is this the right workshop for me? Well, let's vet this out a little bit. Most of the people that I deal with these aches and pains get to me after a period of time and have concerns because they're finding it more difficult to do the things they used to be able to do easily. And they can see the future then. If this is getting hard for me now, what's going to be like in 5, 10, 20 years? As people, we want to be independent. And most people are concerned that they're going to become dependent upon others. So if that's you, this is a good place for you to be. And those people often start wondering and asking questions like, can I make this go away at all? Or maybe I need a surgery of some sort. Very, very common questions. Hopefully questions we can answer to some degree tonight. A deep question is this: if I can't exercise, or even more basically, if I can't move comfortably, most people understand that they'll probably move less. And then the concern is, what is this going to do to my overall health? What we're going to speak about tonight is really good for whatever joint ache or pain you're having, but it is a bigger issue than just one particular joint. Your ability to move, how often and how well you move, is directly tied to health and longevity. And we're going to talk about that as well. One of the truths we'll talk about is the fact that in our bodies, each joint doesn't exist in and of itself. It's part of a system, a movement system, and it's therefore very much influenced by the joints around it, especially the close neighbors. And that's true of you too. You influence those closest to you. You are most influenced by those closest to you as well. And when we understand that when we have aches and pains, man, it's hard to be in a good mood. It's hard to treat others around us well. If you found that you've been short with people because of discomfort and pain, this is a great workshop for you. And ultimately, hopefully I can teach you some simple things that'll help you take better care of yourselves and then better care of your families as well. And important note is that we want to do this as best we can without becoming dependent upon medications, injections, and surgeries, because all of those things have side effects. And also, one thing we will discuss tonight is all of those things, though they might make us feel a little bit better for a little while, don't get to the root of the problem. So tonight we're going to teach you how to move better, how to move more often by focusing on the root of the problem. So if you were hoping to hear a quick fix, do this 1 or 2 simple exercises and your life's going to be 100% better. I wish I could tell you that, but I can't. These kind of issues develop slowly and gradually over time in most cases. And so therefore, one thing isn't going to make it suddenly better. It's little stuff repeated over time. It's not necessarily complex. It's just a little bit more about being the tortoise rather than the hare. So if you aren't looking to take some control of your health, if you'd rather just have the snap, crackle, pop approach instead of trying natural healing methods, this may not be the right place for you. However, I want you to ask and answer a few questions now. So if you would, click on that chat button, just tell me, where is your arthritis issue? What's the worst area? And is there specifically something that you do that would make that issue worse? Those are 2 really important questions. Where is it, the worst spot? And does something that you do make it worse? So go ahead and hit that chat button and answer those 2 questions. The other 2 questions are interesting, but a little bit less important. How significant is the pain on the 1 to 10 scale, and how long have you experienced it? Though the answer to those 2 questions won't necessarily tell me if what I have to offer you is beneficial for you. It might give us an idea of how long it would take to get benefit for what we're going to talk about tonight. The things that are more painful, have been around for longer periods of time, tend to take a little bit more time to get better. But if you have a specific pain at a specific area that's worse because of a specific action, there's actually some good in that. So Jane says hands, fingers are stiff in the morning. There you go. Very good. Let's see. Rachel's saying my knees, and it's usually from walking and weight-bearing activities. Very, very common stuff. Charlotte says right hip. That's a common one too. Jim says my back. I've been told I have significant arthritis. So what we're seeing here for most of you, the hands a little bit different. Hands are really, really important part of our body that we use every day with lots of different functions. Heavy strength and fine motor stuff. Most often, people have arthritic issues that affect weight-bearing joints, and the rest of you are talking about weight-bearing joints of the hip, of the back, of the knees. It can affect any body part, of course, but the reason I'm asking this question is this. See if I can get this to advance. There we go. If your pain is reproducible with a specific activity, even though it kind of sounds like that should be bad news, and believe me, I wish that wasn't the case for you, but if it is specifically reproducible with a specific task, then there is some good in that, because it also tells us that it's also potentially reducible. If there are functions that make us hurt worse, we know that that issue is mechanical. And if there's a mechanical problem, with a movement-based approach, we can do something to take the stress off that joint so that you feel and you function better. So here's what we're going to discover today. We're going to talk about what arthritis is. I want you to understand how to manage it naturally. We're going to talk about some simple, effective treatments that get to the root of the problem. In order to understand this, though, you need to understand trauma. Now, when you hear the word trauma, most people anyway, think about big, significant things like, breaking a bone or a car accident or falling from a height and bruising or fracturing something. Those are major traumas, of course. That is one type of trauma. This is what acute trauma looks like. I'm describing acute trauma when we talk about those major things. Sudden tissue damage followed by time during which we as humans, living organisms, go through a repair and remodeling healing process. And most of the time, the types of traumas that we experience from a sudden exposure to a stress will get better given time. Once it gets below the symptom threshold, we don't know it's there anymore. When we're younger, we can heal a little bit more significantly and more quickly. When we're older, it might take a little bit longer time. Now, those things that come on from one major incident are real, and we see those type of clients in our clinic for sure. But the thing that most often impacts us from an arthritic standpoint is that this is a gradual process, more cumulative, and it looks a little bit different. This arrow is slowly building over time. It's not the result of one incident. These cumulative trauma issues are the result of little stresses repeated over and over and over again over time. So this arrow took a few seconds to climb on my screen. But it could literally be months and years before we get above the symptom threshold. There are changes occurring in the human body that we're not even aware of because they're below the symptom threshold. And once they do just climb above that symptom threshold a little bit, most people will tell me, well, it's not horrible. It's not the worst thing in the world. I can feel it. It's not the same. I can manage. It's not that big of a deal. But if we keep exposing ourselves to the same stressors repeatedly, day in and day out, year after year after year, the end result for many people is the cumulative trauma continues to build and the symptoms become more frequent, more intense, longer in duration. Why do I have those two buckets on there? Well, because cumulative trauma is kind of like catching water in a bucket. It's slow and insidious, but it's very predictable. The first thing that we notice when some water fills our bucket from cumulative stressors is that we're a little bit more fatigued. So I've been a physical therapist for more than half my life. I'm in my early 50s. Being a physical therapist isn't physically demanding like many jobs are. That being said, after 28 years as a physical therapist, I have more fatigue at the end of the day and more fatigue at the end of the week than I had when I was a 27-year-old physical therapist. There's no doubt about that. That's because my body is changing. Cumulative trauma is impacting my body. We're not meant to last forever. Things do change. And understandably, many people understand that and say, you know what? I get that. I'm not a spring chicken. That's the way it goes. That's life. And so we just keep doing the same things, right? As long as we can, we try to just be active and do the same things. But more water fills that bucket eventually, and it goes to the next level. After fatigue, we begin to experience what's known as discomfort. Probably the best description I can give you of discomfort is just feeling a little bit stiffer, a little bit more soreness. It takes a little bit longer to get warmed up. You need a little bit more recovery time after some more physically demanding activities. If you do something that's physically demanding that you're not accustomed to, you deal with aches and pains for several days. I was on vacation a couple weeks ago and we played pickleball for an hour and a half. And I'll tell you, I had some knowledge of some discomfort that was not normal for me. There was definitely stiffness and soreness going on because my joints can't handle what they used to be able to handle. And again, many people then excuse that and say, hey, you know what? I understand that. So we keep doing the same things. We try to stay active. We try to stay productive and functional, but more water fills the bucket. And eventually for many people, it's no longer just stiffness and soreness. It hurts. It really hurts. And at this point, people most often say, you know what, I can't just keep doing the same thing anymore. I can't ignore this. I got to do something about it because they know they're close to having this overflow on the bucket. So our goal today is to teach you how to get water out of your bucket or to build your bucket so you can catch more water. And the sign that tells you how far advanced you are with cumulative trauma is it's actually three separate things. How frequent is your pain? How intense is it? And how long does it last? And again, as I said earlier, it's not just about your joint symptoms. When we don't feel comfortable moving, we move less, we do less, and that's bad for our overall general health. In America, there are 6 things that we spend 83%, maybe 86% of our healthcare dollars on. 5 of the 6 are directly tied to movement. Musculoskeletal issues are number 1, and that's easily the most significant healthcare spend in America. Number 2 is heart disease, also impacted by our movement habits. Number 3 is cancer, less impacted by our movement habits. But the next 3, diabetes, obesity, and depression, definitely directly related to our movement habits to some degree. So what I'm teaching tonight is good for your joints, but it's also good for your general health. So I want you to use medications, injections, and surgeries less. I want you to see the doctor less often, to take fewer medications, to have fewer surgeries. That's all good. But as I told you, most of the time when we start to recognize that there's a problem, we don't do anything about it. It's small. We don't want to be a squeaky wheel. The single biggest problem that people make with regard to their musculoskeletal health is they ignore it for too long. At the early stages, it would be much easier to fix, but we typically ignore that for too long. I'm sitting in a house that is 109 years old. I'm in the newer part of the house. When we moved in here 9 years ago, I had the insurance company come and they said, yeah, we'll insure this, but we're not going to insure that roof. You got to get those shingles replaced. They're old. And they were. And, we just bought this home. It wasn't cheap. It's a big roof. I knew it was not going to be cheap to replace it. So I went inside and I looked around and it looks okay for now. Now, I'm happy to say I didn't ignore it too long. If I had, what would happen, right? I would have been left with a bigger problem that was more costly to deal with. That's the way it goes in life. I replaced it a few years ago. All's well, so I'm happy about that. But that is the natural reaction. We want to ignore real problems if they don't seem too big. You guys are here tonight, so you're not doing that anymore. Unfortunately, most of the time, the next step is not really a true solution. If we go online and search Google for my knee pain or my hip pain or my hand pain, you're going to get lots of answers. Unfortunately, most of those answers aren't real answers in terms of looking at the root of the problem. They're just ways to kind of mask the symptoms. Medications, injections, and surgeries are all ways to deal with the symptoms, but they don't necessarily get to the root of the problem. So my challenge to you tonight is to understand it and do something to get to the root of the problem. That's the true solution. Most of these issues, you must understand this, are not actually even medical issues. They're mechanical issues. If something hurts because you do a particular thing, it's because of movement mechanical stresses. Okay? So you can't lift up your shirt and say, oh, look at that. My shoulder hurts. I'm low on ibuprofen. I just need to take more ibuprofen. That'll make it better again. While it might make it feel better, it has not solved the problem. It has not answered the question is, why is that hurting in the first place? We're going to talk about the answer to that question really soon. But know this, most of them are movement issues, not mechanical or not medical issues. So they need movement solutions, among other things. Very, very briefly, I don't want to get too deep in the weeds on this, but I want you to understand this. If I told you, well, you have an inflammatory problem, you got some inflammation going on, naturally, most people would say, okay, well, maybe I should take an anti-inflammatory. That's what we've kind of been taught in America to do. And I've done that some of my life as well. But I want you to understand that inflammation is a normal part of the healing process. It's a natural part of wound healing. Phase 2, from day 3 to day 20, after a tissue gets irritated, there's an inflammatory process going on. We actually need that process to occur because it helps prepare for the development of blood vessels. And when we have more blood vessels in this area where the tissue is not healthy, as time goes by, that tissue is going to get more blood flow and therefore get more nutrients. And what that tissue needs to stay healthy over the long haul are nutrients. It needs those nutrients. So if we just take an anti-inflammatory, we're not actually facilitating the body's natural system of healing. C.S. Lewis wrote in an essay probably almost 80 years ago, the magic is not in the medicine, but in the patient's body. What true effective treatment does is it stimulates nature's functions or removes hindrances. So taking an anti-inflammatory doesn't stimulate nature's natural functions. It actually limits the body from experiencing this natural inflammatory portion of the healing. It doesn't remove a hindrance, it actually adds a hindrance. So don't hear what I'm not saying. It's not that we should never take ibuprofen, but I strongly believe that we've gotten too dependent upon that, and it's fool's gold. It's stopped the body from doing what it needs to create vasculature to feed that tissue. All right, so let's talk about arthritis first. I want you to understand that arthritis is an umbrella term that covers several different types of joint inflammation. A-T-H-R, A-R-T-H-R, sorry. Arthur talks about the joint, itis is inflammation. So we're talking about joint inflammation when we talk about arthritis. Now, most of you are probably experiencing what's known as osteoarthritis. That's the most common type. It's kind of known as the wear and tear type of arthritis. Osteoarthritis, osteo stands for bone. So it's arthritis affecting, it's where two bones come together in that joint. Now we're going to talk a little bit about rheumatoid arthritis and psoriatic arthritis. Those are both joint inflammatory conditions as well. But those things are more autoimmune, systemic bodily issues, not not the same as osteoarthritis. Osteoarthritis is pretty normal. Unfortunately, it gets accelerated because of biomechanical stresses of the joint. Even if you're talking about rheumatoid arthritis or psoriatic arthritis, in most cases, there is not just rheumatoid arthritis or psoriatic arthritis being experienced in a vacuum. There's probably also osteoarthritis happening at many of those joints as well. Osteoarthritis affects a large percentage of the population. It says, it was one of the articles I looked up, talked about 20% of the US population is impacted by it. That's underestimated. Now, if the definition of impacted by it means dealing with pain and those kind of things, maybe that's closer to the truth. But if we took X-rays or MRIs of people that are 35 and older, almost everyone's going to have evidence of arthritis. Most of those people don't have pain, and that's a really, really good thing. So what I want you to know here is this. This is the spine findings with, I think, probably an MRI here, age-specific findings. This is amongst a group of people that are asymptomatic. They have no back pain. Okay, so 50-year-olds with no back pain, 80% of them have disc degeneration, 60% have a disc bulge, 36% have a protrusion of the disc, a little bit more significant than a bulge. So you can see, even less than 40, clearly as you get older, these things become more common. A higher percentage of people are impacted by this, but I want to return your attention to this word asymptomatic. These are people that have no real pain at all. They still have arthritis. Okay. What are the risk factors for osteoarthritis? Well, there are several, some of which are modifiable and some which are not. You can't change your age. If you have experienced a traumatic event, an acute trauma at a particular joint, as time goes by, it's more prone to osteoarthritis. As we talked about, some autoimmune issues can facilitate the arthritic condition. Family history can have some impact on that, and females are a little bit more prone to that. Those are all non-modifiable factors. There are several that are modifiable, being overweight, having low strength. There's lots of evidence that strengthening is one of the best things you can do to enhance function and reduce pain for a joint-related arthritic condition. Other chronic health-related conditions, and a hint, these things are all related to systemic inflammation in the human bodies. We're going to talk about inflammation as well. Some aspects of your environment, like smoking, which would be one of those things. Now, what do we know about osteoarthritis? Number one, they're most commonly going to be impacting weight-bearing joints. That's what's listed on the right side. And it's going to result in some swelling of the joints, stiffness in joints, difficulty with motion. Those are signs and symptoms. Let's talk about the knee in particular. Okay, what are the pain generators in an arthritic knee? Some people with arthritis have pain and some do not. So we need to ask the question behind the question, what are the pain generators? Why do those people with arthritis that experience pain, why are they actually having the pain while others are not? Well, these people likely have some irritation on one or more of these systems. The periosteum is a layer on the outer surface of the bone, and that can get irritated as a result of mechanical stress at times. There can actually be edema or swelling, inflammation directly on the bone as well. That's a pain generator. And then you talk about the synovitis, the synovial fluid within the joint. That joint, this knee joint, is surrounded by a capsule, which is what is depicted here by this artist's rendering. And inside that, we've got fluid floating in there. Most of it is water. But there can actually be inflammatory byproducts in that synovial fluid as well. And that actually is very painful. That's actually the primary cause for most people's arthritic pain. So again, the question is, why am I arthritic? Or why do I have inflammatory factors in my synovium? That's a really good question. And it is related to two things in particular, quality of movement, and then some systemic issues that we'll talk about in a little bit. I want you to understand, though, that arthritis in and of itself is as normal as wrinkles on the skin. The body's going to wear out to some degree. On the left, you see a very healthy hip, nice and white. You see a little bit of eroded joint cartilage, changes to the joint structure and the surface of the joint on an osteoarthritic hip on the right. Again, that one on the right may or may not have pain, may or may not have significant discomfort, okay? But I want you to understand that people are going to have arthritis. Not all people with arthritis are going to have pain. The source of the pain is probably mechanical to some degree, and it's also related to our body's inflammatory system. We'll talk about that a little bit. Now, quickly, let's talk about rheumatoid arthritis. This quite often involves smaller joints. So I can't remember, was it Jane that had hands? Maybe there's some rheumatoid arthritis going on there. Hands, wrists, and feet in particular are prone to this. This is related to an autoimmune disorder. Most people with rheumatoid arthritis get diagnosed in their middle ages, 40 and 50-year-olds. It can also impact other parts of the system since it's a systemic issue, other parts of the body like eyes, cardiovascular symptoms. Fatigue is a really common complaint in people with rheumatoid arthritis. There still is a movement component. So what we're going to talk about at the end is really, really interesting as well. Less common is the psoriatic arthritis. You've heard of psoriasis, the drying of the skin. That is also an autoimmune condition. About 10 to 30% of the people that have psoriasis actually develop what's known as psoriatic arthritis. This is a young person's disease. Usually you're going to get diagnosed with this prior to the age of 40. And these younger people also are going to notice, first of all, some nail and skin related changes prior to the diagnosis of this. And again, even though it's autoimmune, genetic, systemic, there is a movement component, and appropriate movement and exercise is key. Some of you here have probably been told you have bone-on-bone, knee issues, hip issues. There is oftentimes in cumulative osteoarthritic problems a loss of joint space. Bone-on-bone, though, is a little bit of a misnomer. If you're moving, it's not direct bone-to-bone contact. Arthritis is not an automatic reason to consider surgery. If you snap, crackle, and pop, that doesn't mean that you have arthritis. And if you do the right treatment to help manage your arthritis, that doesn't mean you're not going to snap, crack, and pop. Okay. And it's really easy to believe, well, I'm just going to have to live with this. This is my new normal. Can't really do anything about it. That's definitely not true. And a lot of people also believe that it's just, bound to get worse. If you aim at the root of the issue, you can do something about it. And the key point from a movement standpoint is understand that the tissue that hurts, the joint that hurts, is just the joint that's crying out for help. And it's a part of a system. And the best thing to do is look at the closest neighbors. So for the knee, we're really interested in what's happening above it at the hip, what's happening below it at the ankle. At the low back, we're interested at the hip below. We're interested at the thoracic spine above. Okay. For those of you that are dealing with hip symptoms, we're looking at the low back above and the knee below it. We need to not just look at the joint itself. We have to look at its closest friends. Okay. All right. Here's other evidence that these are pain-free people that have changes to their joints with an MRI study. This happens to be another depiction of the back-related issues, but it's true in knees and ankles and feet and hips and shoulders and in the neck as well. These are findings that are common in asymptomatic people with no pain. Okay, so please understand this. The presence of a pathology is no predictor of pain. Don't do a surgery to change pathology. Figure out why the pain exists and aim at that issue. And usually you got to look at the closest neighbors to the area of pain, because those areas can either be good friends or they can be culprits. Now, the typical cycle of arthritis is I hurt, so I don't want to move as much. And when we move less, we get stiff. When we move less, we don't burn calories, we gain more weight, which creates more mechanical pressure, which furthers the cycle. Downward spirals over time. We need to break into that cycle in some way, shape, or form. I'm suggesting we need to break into that cycle by helping you move better. I also want you to understand that joints aren't made to absorb forces. They're designed to do that. We are created for them to do that. It's just sometimes we create too many stressors because of poor movement around that area in the whole movement system. And that leads to repeated wear and tear. A mechanical stress on that tissue that creates an inflammatory response. And again, people's natural tendencies are, if it's inflamed, I better take an anti-inflammatory. If you do, it might feel better for a little while, but we need that inflammatory process to stimulate the vascularization so that the tissues get the nutrients they need to be healthy. So what are the most common treatments for arthritis? Well, unfortunately, the most common don't necessarily mean they're the most effective. Certainly the most common are medications, injections, and surgeries. Despite all of those common treatments, issues related to pain with arthritis continue to get worse and worse. Joint replacements are getting more and more common. Unfortunately, joint replacements are not necessarily true solutions. I've had a lot of people over the years that get some benefit from that, but if they haven't changed the underlying movement issue, other things are going to wear out over time and they need help at that joint or elsewhere because of that too. It is a risky surgery. There are 20 to 30% of all these surgeries have some degree of complications. Thankfully, most of them are minor, but some of them are not minor. So if we can avoid this and get to the root of the problem without that, that's problematic. The use of opioids is a really big deal. Opioids mask pain. They don't get to the root of the pain. It leads to lots of unnecessary deaths. And then there's the evidence that lots of surgeries don't really do that much either, especially surgeries for arthritic changes in the knees. There's actually a study done of it's called sham surgery, where half these people had a surgery done that truly changed the tissue, and half of them just had a fake surgery done where they didn't do anything. And outcomes like 12 months later were no different between the actual surgical group and the sham surgical group. And the interesting thing is all those people got therapy afterwards to move better. And so the key might have been just learning how to move a little bit better with that. Let's talk about causes, because if we understand the cause of arthritis, we can actually find a way to get to the root of that problem. When we talk about the cause, we're talking about the culprit. And remember, we're talking about mechanical issues, movement-based issues, and we understand that the tissue that tends to hurt is a tissue that's receiving mechanical stress, compressive forces or tensions. And that stress makes the tissue respond with an inflammatory response. So the question is, why is that tissue, why is that joint getting that stress? Let's look at the closest neighbors. And the interesting thing is, the body is made in such a way that if we look from the foot on up, all the moving parts, every other joint up the movement chain needs a different thing most often. Your ankles and feet typically need to be mobilized. Your knee needs to be stabilized. Your hip needs to be mobilized. Your back needs to be stabilized. Your thoracic spine needs to be mobilized. Your shoulder needs to be stabilized. So we're looking at these joints that need a little bit more mobility and proper movement as being the primary culprits. So we're going to talk today about hips, thoracic spine, and ankle and feet. These are not the only causes of mechanical stressors that bring about osteoarthritic pain, but they are the most common, especially at the hip. Now, I've neglected to say this so far, but every body part is made to move, and every body part is made, or every joint is made to move three-dimensionally. What do I mean by that? Well, let's talk about your spine, okay? So the spine flexes and extends. That's one plane of movement, one dimension. That's called the sagittal plane, okay? Spine also side bends right and left. That's a second dimension or a second plane called the frontal plane. And then the spine rotates left and right. That's the third dimension. It's called the transverse plane. Every joint moves three-dimensionally. Every joint needs to have a balance between mobility and stability. And if you're on either end of that spectrum, that's dysfunctional. We don't want a joint to be way too mobile and not stable enough. That's dysfunctional. We don't want a joint to be way too stable and not mobile enough. That's dysfunctional. We're looking for what's called most stability, a funny name that we use that just stands for mobile stability. Not too mobile, not too stable. Balance of those things. So I told you a little bit ago about the tortoise versus the hare, the benefit of doing over the long term little things consistently well. Well, the other story we'll talk about a lot in the clinic is Goldilocks. Goldilocks didn't want the porch to be too hot or too cold. She wanted just right. She didn't want the bed to be too hard or too soft. She wanted just right. We want your joints to be not too mobile or not too stable. We need them to be just right. Most stability is what we're going for. And so If your knee hurts, we need to look at the closest neighbors and assess most ability. And as I said before, the hips, the ankle and feet, and the thoracic spine are the areas that are most likely to have some degree of dysfunction. Okay, so your hips. Think about the positions we're in today. With all the technological advancements of the last couple of generations, I'm sitting at a computer. During the day, I do that quite a bit, some days more than others. We have people that operate heavy equipment, that drive trucks, that are sitting at desks in offices. We're in flexed hip positions today a lot more than they were two generations ago when we were an agrarian society. And in that shortened hip position, that hip flex position, all these hip flexor muscles that start in your spine and your pelvis and connect to your upper leg are short. And bodies adapt to the positions they're in. Those hip flexor muscles get tight. So what happens when we stand up? Those muscles are now getting lengthened. That's either going to pull your spine forward and arc the back, or it's going to pull your pelvis forward, which arcs the back as well. That changes the mechanical stress on some of those tissues. If you're having back pain or knee pain in particular, and arthritic issues there, the hip is the common denominator for both of those problems. Now, the hip sometimes needs to be mobilized because it's too stiff. It doesn't move very well. I see this a lot in a lot of people, especially guys, but it can certainly be the case in women as well. There are some people, though, that have way too much hip mobility. Hips are supposed to internally rotate about 35 degrees and externally rotate about 70 degrees. And I have some ladies are a little bit more common with this. I have some ladies whose internal rotation is 70 or 80 degrees instead of 35 degrees. You definitely need to develop stability to deal with that extra mobility. Otherwise, it's going to create movement compensations at other areas. And like I said before, the closest neighbors to the hip, the knee below and the low back above, are the most common areas that deal with that. Okay, what about the thoracic spine? Do this for me if you would. You don't hear physical therapists say this often, but I want you to slouch. Just let that back slouch get really flexed there. Stay right like that. While you're slouched, try to rotate right and left. Okay, when you move all the way to the end range in one direction, it tightens up all the other movements. And then take a look at people around you and take a look at those thoracic curves. It's pretty common for people to get these, we call it kyphosis. Hunchback is an exaggerated version of that, but a lot of people have increased flexion of their thoracic spine, which takes away rotation. And then think about what we do when we walk. Right foot, left hand, left foot, right hand. There's a lot of rotation that occurs through that thoracic spine. It's the way that movement gets transferred from the upper to the lower extremities. And you notice when you see older people that don't move quite as well as they used to, they don't rotate through their thoracic spine, their stride lengthens, their arm reach, stride shortens, their arm reach shortens, they're not getting that motion, and other parts have to make up for that lack of movement. That extra movement that other parts make up for that area of stiffness are the things that tend to break down. It's not terribly common for people to have thoracic discomfort. But if they don't move off the thoracic spine, the closest neighbors above at the neck and shoulder, below at the low back, are commonly experiencing mechanical stressors that bring about a pain response. And again, there's probably an inflammatory response, but the answer is not to take a natural or an anti-inflammatory. The answer is to find out why the movement dysfunction exists, fix that, and take the mechanical stresses off that tissue. Finally, the ankle and the foot. Okay. This is actually one of those areas that sometimes the foot's too stiff and needs to be mobilized so it can react to the ground the way it's supposed to. The foot, when the heel lands, will pronate, so the arch drops, and then that foot can kind of adapt to the surface it's on. And then as soon as the heel lifts, it stiffens up and it becomes a propeller. We can push off through the toes and propel ourselves forward to the next stride. If your foot moves way too much, that's going to create movement up the chain. If it doesn't move enough, you're not getting natural muscle recruitment to happen there, and other parts have to compensate for that too. So this is certainly an issue where being too stiff, too stable, or too mobile at the ankle foot needs to be neutralized and brought back to that balance of mobility and stability. Otherwise, poor movement at the ankle means we're going to start making movement habits that are really bad on other parts. That's a common reason for back pain. People can't move well through their knees and ankles, they compensate by moving more through the back, and there's enhanced mechanical stress that creates greater inflammatory responses. The bottom line is this: if you've had issues with joint pain, no matter where that is, it's probably a good idea to look at the closest neighbors and figure out if there's a way to create a balance between mobility and stability so we can take the mechanical stress off that tissue. And that's true, especially if you have osteoarthritis, but that can even be true and effective for you if you're dealing with rheumatoid arthritis or you're dealing with psoriatic arthritis as well. Okay? So it's not going to be surprising for you to hear me say this. If you want to eliminate the pain because it's a movement-based issue, you got to find the root movement cause. It's not injections, medications, and surgeries. That might make you feel better for a little while, but it doesn't make you function better. It doesn't make you move better. You got to find the movement dysfunction and fix that. And in order to do that, you have to look at your system. Your movement system needs to be individualized to your specific dysfunctions. You can't say, hey, I've got arthritis pain, it's affecting my back. I'm going to search Google for back exercises. Those exercises are determined based upon your root causes. It's individualized to your body's findings. And we also know that it can't just be looking at the part that hurts in a vacuum because it is part of a larger movement system. You got to look at the whole body and how each of these segments work together. It's a symphony of movement, and every part has a role to play with that. The process is both educational and empowering. And what I mean by that is you need to know what the most important thing is for you to do today. Then as time goes by and your body's change, you need to change that so that you can keep laying foundational layer upon foundational layer on that. Now, it is legal for us to work with multiple people at the same time. I don't recommend that because that's not individualized. It doesn't allow us to be one-on-one figuring out what your most significant need is today. We use our hands a lot, and it's good to do some of those things for sure. But ultimately, it needs to come back to between gravity and the ground, foot on the ground, moving in real functional activities. So those hands-on activities should definitely be combined with real functional movements and exercise habits. So instead of that thing slowly getting worse over time and the symptoms becoming more frequent, more intense, and longer in duration, let's take the mechanical stress off that tissue by looking at the close neighbors and make sure they're doing what they are designed to do so that the movement stress doesn't get applied to another area. That'll keep you below that symptom threshold. And then anytime we're talking about joint-related issues and arthritis, we also have to understand it's not just movement. Movement is exceptionally important and a key component to you feeling better, but it's also about other healthy habits, losing weight, reducing inflammation, finding ways to support your joint. And so what we used to think is it's all wear and tear, it's all cumulative force, it's all related to injury. Those things are still very important, but we got to look at your metabolic system as a whole. And why are you have joint-related inflammatory efforts at play? So this is not my expertise. In fact, we're working on developing some relationships with people that can work on this side of the ledger with people as well. But we do know that there are important components to a healthy lifestyle. And one of them is moving well, for sure, which helps you manage your weight. There's anti-inflammatory diets. Typically, that means less processed foods, leaner meats, fresh fruits and vegetables, very important. That'll help manage your weight, which means more less mechanical stress on your tissues. The quality and the amount of sleep that you get will help your body process inflammatory responses. Smoking is an inflammatory irritant. So stopping smoking, limiting, not eliminating your alcohol consumption, but certainly limiting it. Excess alcohol consumption is not healthy. And then just general emotional stresses, managing that well helps you manage inflammatory stuff as well. So good stuff, all very, very important and stuff that you need in order to feel better and to function better. So we talked about a lot of interesting stuff. I don't think we solved all the world's problems, primarily because it's impossible for you to memorize all this stuff. And we've not even found out yet specifically what your issue is, what your problem is. We've not individualized it to you. We've talked big picture, but now we're bringing it back to you. And we like to say that knowledge is power, but it really isn't. Knowing something isn't the same as doing something. You have to be able to put that knowledge into practice. So here's what I want to offer for you. Getting to the root of the problem, finding simple tools you can practice and repeat at home, You can do that, and we're going to offer this for you, an arthritis pain relief consultation. It simply takes 20 additional minutes of your time. And by asking some key questions and looking at how your body moves, finding whether you have most ability at all those key parts, you can very quickly find out what the top root issues are in your body, what the natural solutions to make that go away would look like, and give you a little bit of confidence and hope and direction with what to do about this. Now, normally that would cost a lot of money. And believe me, people spend a ton of money on chasing these issues. I've been doing this for 28 years, and it's my personal mission to help people stop wasting time and money, to take control of their own health, to use more natural approach and avoid high-risk procedures. So this time we'd spent with you has an open market value of $150. The good news is we want to offer that to you for free. So at least you can get a step closer to what you need to help solve this thing. We can't offer you a money-back guarantee because we're not taking your money, but we will tell you this. If you take us up on this 20-minute arthritis screen and then you find that it is not valuable to you, let us know. We will donate $150 on your behalf to whatever charity you want us to. We do a lot of that. I'm thankful to say I've never had someone come back and take me up on this guarantee because it is not a waste of time. Individualizing this approach to find out what kind of stressors you can eliminate by making sure your system moves as it should is really the key to long-term movement health, which is good for your joints, good for your pain, but also good for your general health. So my offer to you is this. If you want to take me up on this, just hit that chat box. Okay, and just say, I'm in, I want it. And then you'll have to tell me what clinic you want to do this in. So we have 8 clinics, soon to be 9, and here they are. They're in Ames, Des Moines, Colfax, Newton, Pella, Oskaloosa, Albia, and Centerville. So say, I'm in, and tell me what clinic you want to do that in. And then we'll have one of our care coordinators call you in the next 24 to 48 hours to set up a time that's convenient for you. Okay. Let me open this chat. I see people coming through. All right. Diane says she wants to do it. She's in Oskaloosa. Carlin says she wants to do it. She's in Pella. That's great. Jim says, I want to do it, and I'm in Centerville. We'll get you set up in Centerville. Charlotte, she wants to see Ryan. Ryan's our person in Colfax. He's awesome. You'll like him, Charlotte, if you haven't met him before. Okay. Tim says, I want to do it, and I'm in Ames. Great. Let's see. Sarah wants to do it. I have hand issues and she wants to do it in Newton. There you go. Keep signing up, guys. As long as you're in here, we'll be able to do this. Let me do this as you're continuing to do that. This is the information I promised you. This is my cell phone number. That gets right to this. At the very least, I want to be a resource for you. If you have questions about aches and pains and musculoskeletal issues, I welcome you to text me and just ask those questions. Remind me that you were here, and I'll interact with you. If I'm working with a client, I'll get to you between clients or something like that. If you reply to any of the emails that you got since you registered, those always get to me too. So you can ask questions that way. Or this is my direct email, troyvm@kineticedgept.com. You can send something to my inbox that way if you want to as well. I really encourage you, not too many years ago, I would have been pretty shy about this, but I've been doing this long enough to understand that there's a whole lot of people that spend a whole lot of money on things that don't get to the root of the problem. I want you to get to the root of the problem. The next step for you is just to sign up for 20 minutes. Spend 20 minutes with one of our movement experts, and they can very quickly tell you if there's something that can be done. And I want to tell you this too. It's not like do these things and in 8 weeks you're going to have zero pain and move 100%. That's sometimes the case, but sometimes it means I used to experience a 7 out of 10 pain, and I couldn't walk for more than 15 minutes. Now my worst pain is a 3 out of 10. I can walk like for an hour. That is a victory. Sometimes the stuff has been there long enough that you can't make it completely go away. And I can't promise you that you're going to be pain-free. But I can tell you this, if you take stress off a joint, you'll be able to move better. You'll be able to move more often. Your pain will be less frequent, less intense, shorter in duration. I think those are easy goals to meet. Jane, it is troyvm@kineticedgept.com. So right there at the bottom of my screen. Or just reply to any of those emails we sent you when you register, Jane. That way you can get directly in contact with me as well. I'm going to send you a link to this video. So if you want to watch it, you can. Again, I'm going to ask you a favor. If you know of people that deal with arthritis, forward that to them. Tell them to watch it. More people need to hear this message because too many people are suffering unnecessarily and too significant. Patricia, we got you in Oskaloosa. Thank you. So forward that to them if you would. On that, there's a link to sign up for a screen if you want to. But those of you that have already signed up here that have said you're in and where you want to go, that's great. Let's see, Doris. I don't know if you told me where you're at, Doris. So if you put in the clinic, that way we can get you signed up there. So if you're signing up here, you don't have to hit that link, but you can reply to that email too, and that'll get right to me. Appreciate your time, folks. And sorry you're dealing with arthritic pain, but hopefully you understand there are some answers, ways to make you feel better, to take away the pain frequency, to reduce the pain intensity and the duration. Got you, Doris. In Des Moines, we'll give you a call. All right, I look forward to hearing from you if you have questions. Thanks for giving me your time tonight, and I look forward to getting you scheduled for a little bit of time with one of our movement experts. You're welcome, Charlotte. Thank you too.